You getting in the bed?
Oh, yes, I am the patient. Oh, shit. Sorry, I was looking at stuff. Look at this right now.
Let me move this a little bit right away so you don't think I'm cheating. All right.
Is that your hand hygiene?
Yeah. Alrighty. Knock, knock, knock.
Come in.
Hi, my name is Taylor. I'm going to be your nurse for today. I'm going to get my hand hygiene.
Okay.
And I'm going to provide the curtain for privacy. Can you verify your name and date of birth for me?
Yes, it's Bianca Creed.
Perfect. And then do you have any allergies?
No.
Okay, perfect. So we have a order for a head to toe assessment. Is that okay with you?
Yes.
And it's okay I touch you throughout the duration of the assessment?
Yes.
Perfect. So my patient, she has, she's alert, she's oriented ×4, she has a proper, appropriate eye contact and facial expressions. She reacts to my voice, she follows my commands. First thing I'm going to do is assess her head. So her head is symmetrical to her body and is free of masses, lesions, and bumps. Do you have any history of headaches or head injuries? No. And then do you have any concerns about your scalp hair or anything? And looking at your ears are symmetrical, free of drainage. Do you have any difficulty hearing or have any tinnitus, which is the ringing of the ears?
No.
No. And then I'm going to look at your eyes. So your eyes are symmetrical. I'm going to be doing the perla, which just evaluates your pupils and the reactivity, okay? First thing I'm going to do is turn on my pin lines. Pupils dilate accordingly, and then I'm going to have you look at my pin light. Then look at the wall behind me. Then back to the pin light. They constrict appropriately, and pupil size for each is a 3. And then I see that you wear glasses. Do you wear contacts? No. No? Okay. And then I'm going to be checking your nose. Your nose is free of drainage. I'm going to have you cover up one nostril and breathe in. And then I'm going to have you do it to the other side. Any difficulty breathing? Patency's intact. The nose does not look broken. And then I'm going to have you smile for me. The gums are pink and moist. And do you do your annual dental visits? And do you floss regularly? Yes. Okay, perfect. And then all of her teeth are intact, no decaying, no inflamed gums. And then can you swallow for me? Any difficulty swallowing? No. Perfect. Do you have any lesions or ulcers in your mouth or throat? No. No. Okay. And then I'm going to have you take a look to the right. I'm going to inspect your neck. No jugular vein distension. Look to the right. Perfect. And then I'm going to have you forward. Neck is symmetrical to the body. And then I'm going to palpate the carotid on both sides. I'm going to palpate the brachial on both sides. The radial. It's okay if I touch your femoral, which is right up against. Okay, perfect. Perfect. And then these pulses, they're strong. I'm gonna say they're +2. That's the popliteus, and then the dorsal pubis. I'm gonna take off your shoes so that I can feel your pulse. Okay.
Have you had any injuries?
Perfect. +2 on those pulses. And then I'm also going to feel your temperature. Temperature is normal. Skin pigmentation is normal for ethnicity, no hyperpigmentation. Do you have any skin concerns for moles, bumps, any scars that you are concerned about for today? No? Okay. Perfect. And now I'm going to do the cardio assessment. Before I do start, I'm going to list my Glasgow scale because we did assert the level of consciousness. So the Glasgow scale just evaluates your level of consciousness and it looks at eye movement, which is 4, your eyes are spontaneous, and then 5 for your motor, so your and then your verbal, and then 6, so you're pretty high in your Glasgow visco scale. And then Braden scale, I would just be worried about the friction and shear, the moisture, and then mobility. Are you moving around properly? Okay. Because she's able to move around properly, I would say low risk for the Braden scale. And then I'm also going to check the skin turgor. And she is well hydrated. Do you have adequate amounts of water into your daily routine? Getting enough water? Okay, perfect. And then for cardio, do you have any history of hypertension? No. No. And then any difficulty with chest pain or anything like that? Okay. So I'm gonna take a listen. I'm gonna start at that. I'm gonna start at that aortic. Hear it. Pulmonic. Herb's point. Tricuspid. And then the mitral. Yes. Put that in here, and I'm gonna do the 8 full pulse for the 1 full minute. Starting.
So full range of motion, pieces in here, no carpet no cryptics, no cryptics in here, okay?
For time purposes, I'm going to do the 30 and your apical pulse is 74.
Are you using any assistive devices at home?
And then for your
Stay here for
respiratory,
Well,
I'm
you just
also
walk
going to be listening to the front anterior quadrant and the forward back into lateral. But before I do that, I'm just going to check your capillary refill as well.
So no gate, and I'm going to do
Yep. Capillary refills less 2 plus, well groomed, free of dirt, debris. And I'm going to take a listen to everything. Take a deep breath in for me. Again.
You gonna put it right now, or okay? Yeah.
And again.
If you were ready.
I'm going to do a lateral. Breathe in. Again. I'm going to have you sit up for me. Breathe in. Breathe in.
Alright,
Breathe in.
I'm gonna be your student nurse today.
Breathe in. So your you can have a seat back. Your lungs are clear. Your respirations are a 14. Your breaths are even and labored. Do you have any difficulty breathing? No. No. Do you have any respiratory issues in the past? Any lung surgeries or anything like that? Nope. Perfect. And now I'm going to be listening to your abdomen. When was your last bowel movement?
So our parents,
Yesterday.
Yesterday. And then are you passing gas? Yes. Yes. All right. Any pain or difficulty when you use the restroom? When was the last time you urinated? This morning. And then any difficulty urinating? Any concerns about the color or any constants in your urine? Okay. So I'm going to listen to your abdominal wall. I'm going to start in the lower right quadrant. Is it okay if I lift up your shirt? I'm going to inspect the skin. The skin is flat, no distension.
alright, great, so patient is oriented, speech is good. Do you have any issues with speech? Okay, awesome, thank you so much. Alright, so then.
And it is normal active. Heard sounds in each quadrant every 5 to 15 seconds. Any pain when I palpate on anything? Any abdominal surgeries? No? Okay. And now I'm going to assess your range of motion. So I'm going to have you lift up your arm for me, your arms, and then down, circle. And then I'm going to have you push up against my arm.
Alright, and I'm checking the
Push against my arm. Other side, full range. Up and down. And then I'm going to have you push against. Now push towards me. Perfect. Any pain or discomfort in that? Have you ever broken your arm or any of your hands or phalanges? And then I'm gonna do your feet, so I'm gonna have you push against me, and then shut. Now I'm gonna have you move it in a circle. I'm gonna have you do down and up. And have you do that on the other side, down, up, rotate, and then just do down and up regularly. And now I'm gonna have you put on your shoes. And we're gonna assess your gait and balance.
Okay.
And then I'm also gonna look at your edema before you get up, okay? Make sure that there's no swelling. Any pain in your calves? Have you broken either of your legs or feet? Okay, great. So I'm gonna have you get up for me. Have you sit on the edge of the bed? Any dizziness, lightheadedness? No? Perfect. I'm gonna stand. First thing I'm gonna have you do is walk towards me. Heel to toe, yep. And then walk towards the wall. Perfect. Patient, even and balance. Now I'm gonna have you close your eyes. Perfect. No swing. Perfect. I'm gonna have you get back in the bed. I'm going to evaluate my sheet my first and final time.
Okay.
Make sure that I got everything. Have to hold it. And also, I wanted to educate you. So, for respiratory, while you're laying in this bed, I want to ensure that you are getting your full range of motion in your lungs. So, I'm going to place an incentive spirometer right here. You're going to do that every 10 minutes, or 10 times an hour, actually. And you're going to take a deep breath, blow into it, and just keep doing that. It's going to help open your lungs. As well, I'm going to have you take a deep breath in. And then I'm going to have you turn your head. And I'm going to have you cough. So that turn, cough, and deep breathing is going to help break up that mucus and get that out. Do you have any questions for me? Alrighty, I'm going to wash my hands. I'm going to open the curtain back up. I'm going to make sure that the bed is at the lowest position. Everything is out of sight. I'm going to document, and I hope you have a great rest of your day. Thank you.